Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're going to be talking about a topic that is near and dear to my heart, which is why you might want to actually treat the whole face instead of just one part alone. So a lot of patients, especially where we're at in D.C., are very conscientious about how they appear, and they don't want to look fake. They don't want to look like they were overdone. I think generally, a lot of people say that anyway. And one of the things that always comes up in our consults is they will say, well, I actually only really want to do surgery for my eyes or for my jowls or something like that because I don't want to look fake or overdone. And I actually have to counsel them that it's actually better and it looks more realistic if you treat the whole face comprehensively than just splitting it up into different parts. The reason for this is you don't age in just one part of your body, so it doesn't make any sense, and it actually looks more fake or more overdone, or something is wrong if, for example, your eyes are the eyes of a 20-year-old, but then the rest of your face still looks like you're 50 or 60. That doesn't look realistic. Everyone else will get immediately drawn to what is different about you, which then highlights that you might have had some plastic surgery. The example that I learned in fellowship that I always like to bring up is, imagine that you have an older hotel, one back built in the 80s, something like that, and you're trying to update it, modernize it. So you spend all this money and you build a beautiful lobby, beautiful restaurant, etc. Your guests come, they get in the elevators, they love their lobby, they go upstairs to their room, and the room still looks like it was from the 1980s. What are they going to remember about their stay? They're going to remember the 1980s room. So just like that, we want to make sure that the whole face is being addressed comprehensively when we are looking at anti-aging surgery. If you do have to split things apart, I do usually say you should talk to your surgeon about what's the best way to do this in a realistic fashion. For example, sometimes it's not safe for you to have too many surgeries done under one trip of anesthesia. That is something that you guys can discuss individually in your consults, but generally I would say plan to discuss the whole picture. So that's me. I'm Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery. I'll see you guys next week.